Speaker. Just emphasize, I think the videos that Kim showed were so powerful, especially the first one, because it reminds us that this is about people, it's not about technology. And our messaging is that it is about health, not just about health care. And it's interesting, and I feel I'm an optimist at heart, I suppose, but our next speaker, Raj Pannu from Mccann Health, is here, and his charge, and Mccann has taken on the notion, this is the biggest health communications company in the world, a communications company in the world, and they have a focus on driving the global public health community to adopt these technologies. And I noticed on their website that they recently changed their name for this group from McCann Healthcare to Mccann Health. So that gives me hope that these messages are being received by the commercial world, which has to drive many of these changes. So Dr. Raj Pannu is Director of Global Public Health at McCann Health, and please welcome him.
Hello. Can you hear me? Yes? Okay. It's great to be here. It's fantastic to be here. Thank you so much for this opportunity to speak at this wonderful conference that really exists at the nexus of research, of technology, and of course of health policy. And you know, I have to apologize in advance because I'm not going to be talking about any of those things here. And so that's the first apology that I have. The second is that originally scheduled today was our CEO, but unfortunately he was called away, so unfortunately you guys are going to have to deal with me, so that's the second apology. So I've disappointed you twice, and I haven't even started the speech yet, so hopefully it'll speak for itself. So what I'm going to be talking about is demand creation, and I think this is, you know, this has been such an interesting experience over the last couple of days because, you know, it's almost the kind of invisible gorilla in the room, if you will. I'm not sure that's an actual phrase, but you guys feel free to tweet it and use it. In a sense, because, you know, there's a lot of talk about new technology, and this is, of course, absolutely essential to how mHealth is going to progress. But, you know, part and parcel of introducing new technologies, new initiatives, is making sure that there is sufficient demand within your target population for those products and services. Because if there isn't, then it doesn't matter. Then it's just background noise. So, you know, in a way I'm speaking on behalf of McCann, but I'm actually speaking on behalf of marketing and communication companies, you know, large ones around the world, because there is a methodology, there is a way to approach strategic communications that has been shown, you know, since time immemorial to be successful in driving behavior change and adoption of new practices. And I'm going to share some of those with you today. So let's talk about very quickly who we are. So McCann, obviously, it's part of McCann World Group. McCann World Group, one of the largest advertising, marketing, and communications companies in the world, and you know, unfortunately, also the largest spreader of measles throughout the world, as you can see by this map. Truly, you know, global footprint. And, you know, we have a lot of long-standing relationships with very large companies and many over, you know, decades and decades, helping these companies sell commodities and services around the world. And McCann Health basically uses these same techniques that have been utilized to sell commodities in the health space to, you know, basically drive demand for pharmaceutical products, among other things. So what does this have to do with global public health? Well, in terms of what we've found is that global public health is very often about driving behavior change. I think we all recognize that. And one thing that we know for sure is that if you're just creating awareness of a problem, that is not sufficient to drive behavior change. Creating awareness is not creating demand. So in order to essentially implement effective behavior change efforts, it's very, very important that sort of rigorous data-driven demand creation methodology is used. I mean, there's no doubt that that's true. And what this means is an increased emphasis on the customer. That is, the person that you're trying to target. What do they think? What are the barriers to use of whatever device or service that you're trying to implement? And understanding essentially the relevant forces that shape customers' habits and perspectives is what's going to get people to use technologies. The last part of demand creation, of course, is using some kind of methodology. Very often in public health, there are attempts to recreate these ideas using studies and research and trying to essentially reinvent the wheel, when in fact there are methodologies that communications companies, for example, use all the time to do all of these things. And I think that this is what the private sector certainly has to offer in terms of global public health. So if you think about it, a lot of the big problems in health have essentially been driven by market-based uptake of health, products that are essentially bad for people. Take tobacco, or whether it's bad food products, and the methodologies that were used to drive the uptake, the change in behavior, and the uptake of those kinds of products. What we're saying is we need to simply use those same strategies to counter-detail those ideas. And I think it's important. So there are basically three pillars to any kind of demand creation platform. The first, of course, is assessment and insight. The second is developing your messages and figuring out how to engage your target audience. And the third is being able to measure and evaluate what you've done to make sure that it's impactful and to make sure that it's working. And underneath these sort of pillars, of course, there are methods to go about conducting this kind of work. And obviously, market research is absolutely essential. And trying to basically figure out what the dynamics of the market are, and trying to include all the necessary and pertinent relevant information that's going to drive uptake of whatever product or service that you have. The second, in messaging and engagement, well, once you know who your customers are and what they think, then you can develop a strategy. It's the strategy and the concept, the execution, and that is part of essentially the communications plan. And once this has been accomplished and implemented, then you can go back and use analytics to understand how successful that you've been. It's actually incredibly intuitive. And yet, very often in the public health space, this is something that has been overlooked. And I think probably to the detriment of many kinds of programs. So at McCann, we use this thing, it's called the truth to transformation process. It doesn't really matter, but the key point is that you've got to find out what the problem is. That's the most important thing. We call that the naked truth. We have to know what fundamentally is the barrier that you're trying to overcome in your customer's mind, in their behaviors, in their habits, that allows you, to then counter-detail it, to come up with that perfect argument that, may be most impactful. And obviously, the truth, knowing what that barrier is. And it could be different for different communities, and that's something you would have to know as well, so you can target your communications. That is based on this ecosystem of factors, the category, the company, we call it the 5 C's. But the point is you must ask critical questions in order to get to the truth. And it's only when a rigorous analysis of people's behavior is done that you're going to be able to find the best ways to influence them. And then, of course, in advertising, we develop creative briefs, and we try to essentially, what we call the transformational truth, is then that ability to successfully argue to implement whatever it is that your uptake of your product or service. This is absolutely essential, because when you get to the next step, which is messaging and engagement, at this point, this is how you develop your strategy. And I think the point about mHealth apps or any of these other technologies is that the technology cannot be leading the discussion. What needs to be leading the strategic framework is, who are you trying to talk to and what do you want them to do? And this has to be absolutely rigorously defined in order to drive uptake. So obviously you have to be nimble, you have to be able to use key performance indicators to be able to analyze uptake, and we know that there's so much big data discussion over this conference, and we know that this is going to be certainly a key part of mHealth applications. So when we look at demand creation in mHealth, I think probably the key unmet need is trying to make sure that we're not letting the technology lead. I think that's probably the key takeaway, because of course there are amazing breakthrough technologies that can do extraordinary things, certainly in mHealth and other places. God, think about the airplane. I don't think you have to sell the airplane. I think the airplane pretty much sells itself. But generally speaking, when it comes to the vast world of mHealth technologies, there'll probably be many, many, many different technologies, all sort of competing for share of voice with the same customers. And that is something that we have to sort of consider, and that is why sort of strategic approaches to drive uptake, to drive demand for these products, to see how these products can be used, optimized ergonomically, to allow the consumer to have the best possible experience so that it makes sense to their lives. That's why it's important. Because essentially, that's what we're talking about. We're talking about this ecosystem where the consumer, the individual, is at the center, and around that consumer there is this sort of giant noise of public and private sector interests. And what we're trying to do is get this consumer to make generally healthy choices that will improve their lives. And by doing this with individuals, it can have tremendous impact on societies. And so our proposition, to reiterate, is simply make sure that strategic approaches to communication are implemented before these technologies are created or in the process of creating these technologies. Because obviously there's an enormous demand. You just look, there's so many slides that we've seen where we see the extent of chronic disease or even transmission of infectious disease, and we know that these incidences are rising, and certainly globally public health needs to, there's an enormous need for successful personally directed interventions. And of course it's not just that, but there's a significant economic impact of these diseases and conditions. Absolutely, no question about it. Which means that, successful implementation is of paramount importance. So ultimately, I guess what we're saying is that, I think, certainly if you look at developing countries, when so many technologies, so much infrastructure has been created in the hopes that people will just come and use, the products or services. And you know what happens? They spend a lot of time and a lot of money, and they build up these things, and nobody uses them. And so strategic approaches to demand creation, it certainly must be a factor, and certainly in mHealth as well. Thank you very much.